Good afternoon, everyone. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before we begin, I'd like to introduce the Premier of Nova Scotia, the Honourable Iain Rankin, and Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Thank you, Chrissy. Today we are reporting 54 new cases of COVID-19. The majority, again, are in the Halifax area. We are seeing encouraging signs showing promise that we are crushing this wave faster than other provinces have been able to. Thanks to Nova Scotians for sacrificing hard during long weekend, the first long weekend of the summer. It's hard not to socialize or gather, but necessary to get us to a better place that we all want to be. I also want to give my condolences at this time to the 3 Nova Scotians we lost over the weekend, 1 person in their 60s and 2 in their 70s. So on behalf of all Nova Scotians, my condolences go out to those families impacted yet again. It's so tough, and our thoughts are with you all. There's good news on the vaccine front. Earlier today, we opened up to those that are aged 20 and up. By the end of this week, we should be able to open to 12 and up. So get out and get your vaccine. We promised Nova Scotians by the end of June, every person would have a shot to get their first shot, and now we've exceeded that promise. Again, this underscores the effectiveness of our program, that we are far ahead in getting vaccines into the arms of Nova Scotians. Remember to book your appointments and get vaccinated so we can reach our 75% target of all Nova Scotians getting vaccinated. We will begin our second dose early in June. Our delivery plan for second doses has been sped up by about 2 to 4 weeks, and Dr. Strang will have more to say about that. I want to add also that all of our residents in long-term care facilities have had their 2 doses, and Nova Scotia is leading the country in participation of pharmacies delivering our vaccines. So I want to thank the Pharmacy Association of Nova Scotia for stepping up to help with the vaccine rollout. We've hit 500,000 as a milestone on Saturday, and I helped join with Minister Churchill thanking those in Yarmouth for delivering vaccines. And a big shout out to those aged 75 to 79. They're leading the pack in Nova Scotia. 99% of people between the ages of 75 and 79 have their first dose. That's really great, and us young folk have some catching up to do. So I actually got vaccinated just yesterday, and I was very excited to get my first shot. Mary got her shot the day before, and we are very excited. It means that the adults in our family and our parents are vaccinated. So I want to thank all the staff that were at the Halifax Forum that delivered their vaccines for us. A special shout out to Sharon. Sharon Chapman was a retired nurse that delivered my vaccine to me, and she made the experience very enjoyable. Anne was Mary's nurse, and again, she's a retired nurse who answered the call to come out and help with the vaccine rollout. And it's just a sign that all of us Nova Scotians are coming together. People are stepping up so that we can get through this process. Hospitalizations continues to be where we watch very closely the numbers. It is good to see numbers starting to come down. I know people are asking for and have been asking for restrictions to be relieved, but we needed to see these hospitalization numbers going down. Looking at what's happening in other provinces, we're very mindful of the numbers in ICU, and I am concerned for the people still in ICU, but know that they are getting the help they need and people are being discharged. That's the number we all need to be worried about and learning from what's happening in other jurisdictions. I have been hearing from businesses about a reopening plan, and Dr. Strang and I met today just before the briefing to discuss what a reopening will look like now that our numbers in hospital are starting to come down. There are key conditions that have to be met, but we are getting there thanks to the hard work of Nova Scotians. We'll have more to say about this in the days ahead. And before I pass it back over to Dr. Strang, I want to also note that the applications open up tomorrow for our sick benefit program. So that's a program that fills the gap left by the federal government with their program. If you are missing less than 50% of your work week, if you need to take a day or a couple of days off, you can do so, and you can do that if you're waiting for your COVID test, if you're getting tested, if you're self-isolating, if you're getting vaccinated, and employers will be reimbursed that amount. It's a simple and efficient process with direct deposit for fast results. I want to thank Nova Scotia businesses for continuing to support us through the pandemic. This program hopefully will make it easier for businesses to keep COVID out of the work environment and protect and support their employees. And then employees won't have to make the difficult decision between their health, the health of others, and their own financial well-being. Thanks, and I'll now turn it over to Dr. Strang.
Thank you, Premier. Good afternoon, everybody. And Premier, I'm glad to hear that you and Mary got vaccinated yesterday, and it's still not too late. I can book you in for your second dose with my special Habs vaccination shirt if you're interested. So I'll just leave that out there. I'd try. But before we begin, I do want to give my condolences to the family who lost loved ones due to COVID-19 since we were last here. This is understandably a very difficult time, but please know that Nova Scotians are grieving with you. Our case numbers continue to trend downward. While the decline is slow, it shows that what we're doing is working. But we cannot let our guard down yet. It would not take much for this virus to gain ground again. The Premier and I are hopeful we can look forward to starting to reopen very soon, but we're not quite there yet. However, we are getting close. I've said before that the last part of any marathon is the hardest. The finish line is coming into sight, but we need to push hard to get through that ribbon. The fastest path to reopening is the one where we all contribute. Keep following restrictions even when no one is looking or the risk is low, you feel the risk is low. Get tested, often if you are out and about having more contacts. Stay home if you're sick, even with one mild symptom. And if you haven't booked an appointment for your first dose of vaccine yet, do it today. Earlier today, Associate Deputy Minister Tracy Barbrick, our vaccination program lead, gave media an update on our progress. We are several weeks ahead of schedule. Our original goal was to have all eligible Nova Scotians book an appointment for their first dose of vaccine by the middle of June. I'm very happy to tell you that all Nova Scotians 12 and over will be able to book their first dose of vaccine before the end of May and get their first dose delivered into their arm by the end of June. 48% of Nova Scotians already have one or more doses, and another 130,000 appointments are booked over the next 2 weeks. This is thanks to an amazing effort by Tracy and her team, Public Health, Nova Scotia Health Authority, IWK, the Pharmacy Association of Nova Scotia, Doctors Nova Scotia, our Can Immunize team, EHS, and many other community partners, including, as we heard about, retired nurses who are coming back to participate in those clinics. I'm in awe, frankly, in all that all these people have accomplished. And it is also thanks to the hundreds of thousands of Nova Scotians who have gotten or have scheduled to get vaccinated. Our vaccine coverage rates are over 90% in our older and middle-aged groups, and younger Nova Scotians are quickly catching up. As we open up appointments for younger age group, it's remarkable how quickly they are filling up. So thank you to everybody who has answered the call to come forward, do what it takes to protect ourselves, our families, and our communities by getting vaccinated. I'm also happy to say we're going to be able to move second doses up for everyone. Depending on when you got your first dose, you could get your second dose 2 to 4 weeks earlier than originally planned. So beginning in early June, blocks of people will get an email inviting them to move their second dose appointment up. You can keep your existing appointment. You can book an earlier one at the same location, or you'll even be able to book another appointment at a different time at a different location. We will be inviting people in the same order that groups that were originally vaccinated with their first dose. So we'll be starting with healthcare workers and then moving through age groups, starting with our 80 plus. And if enough people move up their second dose appointments, we could reach the required minimum level of to give population immunity of 85% of all those who are eligible for vaccine by early September. And that's much earlier than we were anticipating when we started the vaccine program. So this is in our hands. When the opportunity comes, get your appointment booked. The sooner we get population immunity, the sooner we'll be able to get back to our new, or we'll be able to start our new normal. And on last Friday, the National Advisory Committee on Immunization updated its guidelines and noted that mRNA vaccines are interchangeable. That means anyone who had their first dose with either Pfizer or Moderna can book a second dose appointment for either of these vaccines. And this is good news given the current uncertainty with our Moderna supply. So if you got a Moderna vaccine for your first dose, it's quite likely you'll be getting a Pfizer vaccine for your second dose, and that's perfectly okay. The two vaccines are interchangeable. And there were also about 58,000 Nova Scotians who got their AstraZeneca vaccine as their first dose and are waiting to hear more about their second dose. By early June, we expect to have the recommendation from NACI on whether you can mix vaccine types for your second dose. So if you had a viral vector vaccine, AstraZeneca, or we don't have Janssen, but that's another viral vector product. What the research will help us answer is, do you have to get a viral vector vaccine for your second dose? Or can you get, or maybe even it's preferred, to get an mRNA vaccine for your second dose? As soon as we have that answer, we'll then be able to give people the opportunity to book your appointment with fully updated informed consent about that. And the final thing I want to mention on vaccines are our two new delivery models, our drive-through and our at-home program for Nova Scotians who are homebound. At the end of the month, we'll have drive-through options in Dartmouth, Truro, and Wolfville. These are great options for anyone with mobility issues or children or adults with sensory issues that make it difficult for them to come into a clinic setting. We're also starting a program for those who are unable to leave their home without significant assistance. The initial rollout in June will target those who are receiving home care or home oxygen, and anyone waiting for long-term care who requires a high level of support. And then we'll expand that from that starting point. As we've done with all our delivery models, we will try it, we will learn and adjust. So I'm very proud of the work the team has done to accommodate in both these models people that have much greater needs for accessibility and how we're addressing those accessibility needs. We have a lot to be proud of and a lot to be thankful for in Nova Scotia. This third wave has been difficult, considerably harder on some than others. We have lost lives and still many others are fighting in hospital. Restrictions, while not life-threatening like the virus itself, have been difficult on businesses and employees and on the public and on many people on their mental health. But we are beginning to see the light on the other side. Our case numbers are trending downward and our vaccine coverage is trending upward. We have all done the hard work to get here and we just need to keep that for a little bit longer. If we have a high level of first dose coverage by the end of June, we can have a much safer and less restrictive summer. And if we have a high level of second dose coverage by September, we can open up even much more. So, and if you've received your first dose, please don't stop there. You need to get your second dose as soon as you can. And even if you're vaccinated in this period of time right now, it's important that you continue to follow all the public health protocols and restrictions like everybody else. We have to keep up the pace now that the finish line is finally in our sights. Chrissy.
We'll now take one question and one follow-up in the time that we have for today, beginning with CBC's Shayna Luck.
Hello. Dr. Strang, you said you're optimistic that people are going to be getting their one or two shots even faster than we thought. Just wondering, you touched on this a little bit at the end, but can you give a general sense of what the summer looks like once we get beyond the lockdown?
So we'll be talking, if you're talking about restrictions, we'll be talking a lot more about that on Friday. There's still some work we have to do, and we'll be able to talk about what the different phases of the reopening up and where we will end up for the summer. We have to plan the summer based on, a coverage rate of first dose of vaccine. And then we can start to talk about what the fall looks like with high levels of coverage for 2 doses of vaccine.
How about your follow-up, Shayna?
Thank you. Yeah, anecdotally, we've heard that people sometimes start to change their behavior after getting their first shot, probably after their second too. You alluded to this again at the end, but are you planning on setting any guidelines at any point for people with one or two shots?
That's part of what we're looking at with our public health measures, starting to distinguish between people who are maybe vaccinated or not. But we're not there yet. The vaccines, people can still get through breakthrough cases. They can still be, although their risk is lower, they can still pass the virus on to others. Until we get a high level of vaccine coverage, we still need everybody to follow the same public health measures, whether you're vaccinated or not. That will change, but we're not quite there yet because we're not where we need to be in terms of our population immunity.
Next, we'll move on to Natasha Pace with CTV.
Thank you. I know, Dr. Strang, you just mentioned that you're waiting for more information from the NACI study about what to do with AstraZeneca. Is there any concern that at this point the supply we have, the 2,000 doses, will need to be discarded, like it won't be able to be used at this point in time? What are your thoughts on that?
No, we have about less than 2,500 doses left. It expires the end of June. We expect to get the answer from NACI early in June, and with a number of people that the vaccine is out in our AstraZeneca clinics, we'd be able to immunize those people very quickly once we get the NACI information, update our informed consent, and make some final decisions. So no, I'm not worried about wasting the AstraZeneca vaccine.
Go ahead with your follow-up, Natasha.
Thank you. I'm wondering if you have any idea the number of people in Nova Scotia that will be needing to access either the drive-through clinics or the home vaccinations who are unable to leave their home for a shot.
We don't. We don't have kind of groups that we can give a firm number on people with, whether it's accessibility, whether it's mobility or sensory challenges. As we have firmer numbers. I don't have them with me right now. We would know who's in our home care or home oxygen program. But as I said, that's our starting point, and we'll probably discover as we do that, we'll discover other groups that would be helped by having that kind of home access. So we'll evolve this program. We'll adjust it as we'll see what demand there is over time.
Next, we'll move on to Alicia Drouse with Global.
Thank you. Dr. Strang, I'm just wondering if NACI says that it has to be AstraZeneca that needs to be used for the second dose for those who've already had their first dose of AstraZeneca. I'm just wondering, will we actually have adequate supply? I know that we only have 2,000 right now, and I'm just wondering if the supply that we were supposed to receive, whether it was last week or this week, could go to other provinces in the meantime who are already using it for second doses.
No, we've got that initial amount. We also have our next allotment of AstraZeneca is being held, earmarked for Nova Scotia at a national level. If we need that, we can draw down on that. But ultimately, if it requires more AstraZeneca, that's going to be a discussion we're going to have across the country about what is the AstraZeneca supply and how do we access that, because that'll be an issue across the country, not just for Nova Scotia.
Go ahead with your follow-up, Alicia.
And I know that you said that the mRNA vaccines have now been determined that they are interchangeable, but I am just wondering if you can give an update on our Moderna supply. Do we have any expected shipments right now?
No, Moderna has become very unpredictable, so we're basing all our projections. So everything I talked about in terms of second dose and being able to get people, their second dose, if there's a high uptake by early September, that's all based on our Pfizer supply, which seems to be very stable, although things can happen. So everything we talk about vaccine is supply dependent. If we actually get Moderna vaccine, we'll be able to make that available, we have more capacity to deliver vaccine than we actually have vaccine supply predicted throughout the summer. So if we get Moderna, we'll be actually roll that out in our system and actually move up our end date in terms of getting through the 2-dose program earlier, perhaps into August.
Next, we'll move on to Keith Doucette with the Canadian Press.
Yes, Dr. Strang, I'm wondering, are we wedded to the second week in June for you to reassess the situation? I'm looking at the overall numbers, which seem to be going down, even though the daily numbers, they are down, but they tend to fluctuate. The overall numbers are tending to go downward. Might we see an earlier opening even than and what will we need to see to get there?
So we always continue to look at the epidemiology. It's not just case numbers. It's our 7-day average, rolling average of cases. We look at average number of contacts per case. We look at what percentage of our cases are explainable versus more what we call non-epi-linked, or there's more likely they're community spread. We look at our hospitalization numbers. All those go together to give us a sense of where we're at. So nothing's written in stone. We're continually looking at this, continuing to have conversations with the Premier's office about what can we do. We're always going to focus on what is the right balance between restrictions and opening up, and not having restrictions that are unnecessary or going on unnecessarily long. So it's an ongoing process that we continue to look at on a regular basis. So as the Premier said, we had discussions earlier before this briefing. We're going to have discussions throughout the week and have more to say on this at Friday's briefing.
Go ahead with your follow-up, Keith.
Yeah, and on the vaccine front, I'm wondering, you have an acceleration plan out there. Is there a possibility it could go even quicker should everything align properly, including the amount of vaccine we get? Obviously, this is what we're projecting now. Could this even go faster, or potentially, obviously, slower, right?
Well, it's all about yours. If supply isn't what we predict, it'll have to be slower. If supply is greater, as I just said to your previous question, we actually have more human resource capacity to deliver vaccine than we have vaccine. So if we get more vaccine supply, we can go faster.
Next, we'll go to Nabal Snam with the Herald.
Good afternoon. Dr. Strang, we're hearing anecdotally that some family doctors have not gotten an opportunity to get a vaccine. So I'm wondering what efforts the province has been making to get vaccines to family doctors.
So our second phase of healthcare workers included all physicians, nurses, a number, dentists. So they've had lots of opportunity to get vaccinated, and they can still have opportunity. We're down now in the 20 to 24-year-olds. So any family physician, based on their age now, if they haven't got vaccinated, can go online and book an appointment like any other Nova Scotian who's 20 years of age or older.
Go ahead with your follow-up, Nabal.
Thank you. Dr. Strang, also, we're hearing of the possibility that the outbreak in Newfoundland could be connected to the variant that's identified in India. Was that variant identified at any point here in Nova Scotia, and do you have any concerns about it?
Well, certainly any of the variants have a much greater likelihood of being able to be transmitted, so we're always cognizant of that. We've had a couple of cases of the variant strain that were international students who were quarantining. They'd come into the country and were quarantining. They hadn't spread to anybody else. So we continue to look for do testing at our lab and sending appropriate specimens off to the national lab, looking for any of the variants that are around. This is the latest one, the variant of concern that we're looking for. But we haven't had any major detection of that at this point in Nova Scotia. And as I said, the implications of that are no different than the other variants that we're seeing, the UK variant, the B117 or others. They're more transmissible and can spread faster. So that's currently what we're dealing with. So with the third wave, and so all the measures we have in place will help prevent the spread of this latest variant.
Next, we'll go to Lindsay Armstrong with All Nova Scotia.
Hi there, thank you. Dr. Strang, given that we're ahead of schedule on the vaccine front and second shots will be offered sooner, I'm wondering by how much this shift will speed up our return to normal. And is there any further consideration on Nova Scotia targeting 85% of eligible people immunized ahead of reopening instead of the 75% federal recommendation?
So that's a number where there's a number of factors. The vaccination rate is just one of a number of factors that we look at. We've never said that we have to hit that target before we can start to reopen. What we've said is that reaching that target allows us, as we get how far we can go in our phased approach, through the summer. And the higher our vaccination rate, the safer it becomes for us to open up. The faster we'll be able to, between each of our phases, we can go a little faster. So reaching that number, just on the 85 versus the 75, my concern about the national number of having 75% of your eligible people immunized actually means your vaccine coverage rate for the whole population is only in the 60% range. I think that's inadequate, because it's not just people who can be vaccinated. You have to say how protected is everybody in your population. So that's why I'm focused on we need 75% of all Nova Scotians to be protected with vaccine, because that then protects the other 25%. To reach that 75% of everybody, we need 85% of all Nova Scotians who are eligible, i.e. 12 years of age and up, to get vaccinated.
Go ahead with your follow-up, Lindsay.
Thank you for that. Question for the Premier. PEI's Premier, Dennis King, said that by late August, he expects the province to be open to the rest of Canada for travel. I'm wondering if you're anticipating a similar timeline for Nova Scotia reopening to wider travel.
Well, that's, I guess, similar to your last question, really. The vaccination rates, our own epidemiology, there's a number of local factors that need to be looked at, the evolving science that comes out of the advisory group. But I think that's around the range that we'll have certainly immunity with first dose. We hope to have 85% of our population there by that time, but we'll have to, and our second doses will be well along the way by late August, but I don't want to presuppose where we'll be at that point. Friday is going to be where we're going to give a little bit more high-level detail on a reopening plan on our different phases. But right now, we do see some optimistic signs. Nova Scotia's coming down off the third wave faster than any other province. That's showing some hope, and we continue to look at the evidence when we make those types of decisions.
Next, we'll go to Adrian Blanc with Radio Canada.
Thank you. Dr. Strang, I wanted to ask you regarding reaching out to the younger population because of accelerating the opening of bookings for younger people. Is there any plan to reach out to them?
Yeah, we have a comprehensive communication plan using social media strategies. We've got a number of kind of community influencers, whether it's sports, arts, culture, that we're working with. I'm pleased to say that even as we're opening up to the 20 to 24-year-olds today, we opened up to the 25 to 29-year-olds on Friday, and all the appointments, the initial block of appointments, were taken up very quickly. So all the indicators are, when you look at the number of immunized plus the number of appointments in the age groups all the way down, it's a little early for the 20 to 24-year-olds, but from the 25 to 29-year-olds up, everything we're seeing is telling us we're going to get a high level of vaccine uptake in that group as well, which is really positive. But we recognize we need to do more communication, and as I said, we're looking at some innovative, more social media based ways. That is how people in those age groups really get their information. So our communications team is looking at a number of innovative ways in that area.
Go ahead with your follow-up, Adrian.
Could you give us an update on the situation in Cape Breton? Is there still a community spread, and have the authorities caught up on why there is a spread?
So we know that in the 20 to 30-year-olds, we're seeing that still our cases are really confined in that population, and really what we're seeing in the last few days is the cases, what we're seeing are known close contacts of previous cases. Very often they're in shared living situations, perhaps in also working together in various places. So fortunately, we're in that age demographic in certain groups in the Sydney area. We're not seeing signs of it spreading into the broader population, even within the Sydney community, which is good news.
Next, we'll move to Tim Biscay with the Halifax Examiner.
Hi, good afternoon. Dr. Strang, you're probably tiring of hearing this question, but it's by far the biggest question I get asked of me, and that is of the vaccination status of people who are hospitalized and who have died. You said you may have some more information about that.
So we're working at, my team's pulling together data, not just on hospitalization and death, but everybody. What are we seeing, what we call breakthrough cases? But as I've said before, we expect to have breakthrough cases. People should not be alarmed by this. It's absolutely natural. Our vaccines are not 100% effective. No, nothing in life is 100%, but no vaccine is 100% effective. You will get people who get sick, some even in hospital and some even dying, even though they're vaccinated. That's part of the, the vaccine process. And the greater the percentage of people that we get vaccinated means that more and more of our cases and different types of severity of illness will occur in people who are vaccinated. That's normal. It's just simple math. People should not take that in any way as a sign that the vaccines don't work. That the vaccines are very effective in preventing severe disease and hospitalization, but not 100%. They're also effective. First dose is effective against presenting any illness, and 2 doses or even more. But again, they're not 100%. So you will get breakthrough cases. It does not mean that the vaccines aren't working.
Go ahead with your follow-up, Tim.
Yes, as the numbers decline, I wonder if we may be focusing too much on those daily numbers and the active case numbers at the expense, perhaps, of the so-called long haulers in the healthcare system. Do you have any thoughts on how we should be thinking about long haulers?
So that's an evolving science around people with long-term complications from COVID. There's certainly that recognize that is a proportion of people with COVID can get that. It's also a reason why people should take COVID more seriously, perhaps, because it's not just a mild disease that's over and done with. But there's a lot of evolving science on that in terms of across the country and internationally. There's a lot to learn on that. So even the epidemiology of that, who actually would be defined as, if to use that term, long hauler. So there's a lot of work we need to do in that area, more in the clinical world, but and it's not unique at all to Nova Scotia.
Next, we'll go to Chelsea Gould with the Truro News.
Hello, thank you. Dr. Strang, I'm wondering about the rollout of homebound immunizations. Is the timeline affected where people live, like if they're rural or urban population, or will it be the same across the province?
So the timeline is, we're looking at a provincial approach, and as I said, we're going to start with people who are registered for home care, home oxygen, and those who are with significant support needs who are waiting for placement in a long-term care facility. Our home care organizations are and home oxygen organizations are well aware of all those individuals, and so the vaccination planners are working closely with those organizations to make sure there's access over time across the province.
Go ahead with your follow-up, Chelsea.
Yeah, I'm not sure if I was clear. So when I mean homebound, will everyone who's homebound get their vaccinations around the same time across the province, or, for example, would you maybe start in Halifax and then go elsewhere?
I don't think it's it'll take us some days, if not weeks, to kind of get the vaccine to everybody. And I don't have the details on where exactly we're starting, but it is starting in very soon. As I said, people, we've had to focus on our vaccination of where we get large numbers of people as quickly as possible. But now, as we're getting toward the ends of the first dose, we need to now more of these individualized approaches, and so people may need a little bit of patience, but we will get to people who are registered in these different programs.
Next, we'll go to Victoria Walton with the Coast.
Thanks. This is a question for the Premier. I'm wondering at this point, and over the weekend, I guess, what feedback you got from small businesses about the announcement that was made last week, the increase in the small business grant, whether businesses are satisfied, whether they're still asking you for more. I know a lot of small businesses are still saying this isn't enough, and I'm just wondering what your reaction is.
So overall, it's been really positive. I think businesses, we've a number of their recommendations, changing that grant, being more flexible with a flat amount of $5,000 on top of what they've already received. was helpful. Of course, always more is better. There are federal programs that are combined with our support, but the other thing they're looking for clearly is to look to reopen and a plan to do so to provide some more certainty. So that's where we'll be talking more about on Friday. I can understand the frustration in not having an income coming in during the month of May, but what I can say is these restrictions are clearly working. We're bringing our cases down faster than any other province. That's why we're doing this, so that we can get through this quicker and so that these businesses can open up sooner.
Go ahead with your follow-up, Victoria.
Thanks. And for Dr. Strang, you said that everything's indicating now that the younger age groups are opening up that there is high levels of uptake in the 25-year-olds, and with even 20-year-olds opening today, they're all online booking. But even just last week, you were saying that you were worried. Do you think that those worries were unfounded? Is there actual evidence that you had saying that young people were less likely to book? And I'm also curious, you said that like influencers and social media, has that already rolled out, and what types of influencers and people will be helping promote this to younger people?
Yeah, so your first question, we know in general that that in vaccination programs, younger age groups are less likely, and we know in general that younger adult males are less likely to get any kind of health services. So that we're working on that starting point. We're happy to see that so far we're getting good uptake. We'll continue to watch that with a particular focus on especially the young adult males and how they're coming forward for vaccination. I don't have all the details on the social media program. It is out there, but we need to use that over the next few weeks to this kind of the younger demographic to make sure they're understanding the importance of getting immunized. And again, I don't have individual names, but we've got a range of actors, musicians, etc., people that young people would recognize as fellow Nova Scotians and perhaps listen to them more than they would listen to me.
Next, we'll go to Pat Healy with the Laker.
Thank you. My question is for Dr. Strang. With the testing numbers down, is there anything more the province can do to encourage Nova Scotians to get out and get tested? Is it concerning to you to see the test numbers down?
So thanks for the question, Pat. Yeah, it is. We know that typically on a Sunday, our testing volumes today are just below 4,000, which would be how many people get tested on Sunday. We typically see Sunday as our lowest day, especially on a long weekend. But it's really important. So we need Nova Scotians to continue to get tested. We have lots of access to testing, whether it's through our primary access centers, which are all across the province. People can, if they have symptoms or if they're one of the groups that has been identified as a close contact or a group that's required to get tested, like a traveler, then they can book and go to the PAC for a PCR test. But if people who just have no symptoms at whatever, we're still encouraging them to get tested everybody get tested on a regular basis. And the more frequent or the more contacts you have in your life, whether it's mostly through work now, the more frequently you should get tested. And we have lots of access to asymptomatic testing at PACs and also the pop-ups we're doing. So we're hopeful this week we'll see a push on that testing again. We have lots of capacity in our lab that we can use.
Go ahead with your follow-up, Pat.
Also for Dr. Strang, what is the number of the new cases public health needs to see to allow for an increase in gatherings in the 250, 500 person range at community events or sporting events? Would it look similar to the multiple bubble group used last summer?
So it's not just a single number, Pat. There's a number of epidemiologic indicators we look at along with our vaccine uptake. I think knowing what we know about the virus and how it is spread most easily when you bring large numbers of people together, often in close contact with each other, often indoors. I've said many times, and in public health across the country, people are saying the same thing. Large gatherings, especially indoors, are probably going to be one of the last things that we'll be able to safely bring back. And that's probably into the fall when we have a high level of uptake with 2 doses of vaccine.
Next, we'll go to Blair Rhodes with CBC.
Thank you. I was just wondering, we've been hearing about concerns about homeless people who are not in shelters and therefore would not have been in a position to get vaccines when the clinics were in shelters. Is there any plan to get to the people who are truly homeless and on the street?
Absolutely. We're working with, and we have been all along, a focus on shelters, but also with MOSH, the Mobile Outreach Street Health Unit. And they have a van or a little minibus that's in the HRM area, working with people who aren't even in the shelter community. And we're doing the same up in the Sydney area as well, working with organizations up there which have contact with people who are homeless on the streets, making sure we're doing the best we can to get them opportunities to get vaccinated. And this isn't new. We've been doing this for a number of weeks.
Go ahead with your follow-up, Blair.
Yes. Has there been any discussion or thought given as things start to open up in other areas to establishing something like what has been called in other places vaccine passports to provide proof of vaccination?
So there's a lot of national discussion on that Nova Scotia is participating in. On the technical side, what are the standards that you would have that would be proof of immunization? If you're going to do that electronically, what are the systems that have that? So there's a lot of technical work. But then on the other side of this is how are they used? There's a lot of ethical and other decisions about making sure we don't unjustly marginalize people who, for one reason or another, have not had an opportunity to get vaccinated yet. So lots of discussion about this, but on both of those sides that I just outlined, there's a lot more work to do, and we're participating in national conversations on this.
That's all the time we have for questions today. Go ahead, Premier.
Thank you, and I want to thank all of you for continuing to follow the restrictions. I know it hasn't been easy. This has been a long haul, but we are getting there and would be much longer if we had half measures and more people looking for loopholes. So I'm very proud of Nova Scotians. We are working very hard to look at a reopening, and the fact that we can even talk about a reopening is amazing, given where we were just 1 month ago. Dr. Strang and I have talked about the conditions to reopen, and we continue to monitor that daily. Having virtually half of Nova Scotians now with one shot helps. Getting out and getting tested regularly helps. And supporting these restrictions gets us to reopening faster. We want businesses to thrive again. We want people to be able to visit family and friends again. We want to be able to drive around to different parts of our beautiful province again. And we want to reopen. And we are feeling more and more optimistic about that. But if we've learned anything in the last 3 waves, is that we can't move too fast because that's what can cause spread. The Nova Scotia approach has worked and will work. This week is important. Our job is to monitor all of those conditions, looking for patterns and indicators. Your job is to continue to follow the protocols and restrictions. We'll have more information on Friday about a gradual reopening phase plan that can only happen if all of the conditions are right, and we need to make sure flexibility is built within that. So far, we're moving in a positive direction, and that's thanks to all of you for working so hard to prevent the spread of the virus in your communities. Thank you for your continued hard work and sacrifice, and we'll see you again on Friday.